Welcome everyone to the Osteoarthritis Action Alliance Lunch and Learn for January 2015. My name is Kirsten Ambrose and I appreciate all of you taking the time to join the webinar today. I am pleased to introduce our presenter, Laura Payne. Dr. Payne is an associate professor and extension specialist in the Department of Recreation, Sport, and Tourism at the University of Illinois at Urbana, Champaign. Her work emphasizes ways that people with chronic disease use valued leisure activities to enhance health and well-being, and how chronic disease impacts people's engagement in leisure. As an extension specialist, her goal is to improve the health and well-being of Illinois residents through translational research, education, and training in health promotion and behavior change, and local park and recreation planning that results in the delivery of quality and sustainable community recreation, parks, and wellness programs and services. Dr. Payne also represents the National Recreation and Park Association on the OAAA Action Alliance and is the former Physical Activity Workgroup Chair, so I'm very appreciative of her involvement and happy to introduce her for today's webinar titled The Experience of Arthritis, Reclaiming Leisure to Enhance Health and Quality of Life. Welcome, Dr. Payne. You can go ahead.
All right. Thank you very much, Kirsten, for that nice introduction. Here we go. As everyone on this call knows, arthritis is a huge problem in the United States with over 50 million people being diagnosed with it, and that is expected to increase to 67 million. Many of the people with arthritis are actually under the age of 65, so it is a little bit of a, people tend to think it's an older person's disease, but we know otherwise, and it is a frequently reported chronic condition and the leading cause of disability, which causes a lot of activity limitations, and the consequences are enormous in terms of direct costs and indirect costs to society, and in impact on the healthcare system and in lost earnings from not being able to work and continue in society. With that said, people with arthritis often have other chronic conditions that can complicate their lives, which can also cause stress, anxiety, pain, depression, fatigue, difficult emotions, difficulty communicating with loved ones about their experience of arthritis, tense muscles, and on and on and on. And this can then also affect and result in the withdrawal of valued recreation and leisure activities that are personally meaningful, enjoyable, important to a person's identity and self-concept, and beneficial for many aspects of health and well-being across the spectrum. And withdrawal from valued leisure activities can be very detrimental to their overall health and quality of life. So one of the key questions that my colleagues and I have been exploring is, to what extent do people use selective optimization with compensation strategies of self-regulation to adapt and substitute their leisure activities in order to maintain and enhance their health and well-being? Back in the selective optimization with compensation is really a meta theory that suggests that successful self-regulation and adaptation can positively shape one's health and well-being. And there are actually three interrelated domains. The first is selection, and selection can be characterized in two ways: by loss-based and elective-based selection. So loss-based selection would be situations where the person, because of their functioning or abilities or impairment, must stop doing some things. Elective-based means that they actively choose and identify and prioritize goals and activities kind of proactively in order to deal with losses and limitations. Optimization involves maximizing activity engagement through the use of internal and external regulations, whether it's fueled by beliefs, practicing skills, and managing and and really watching use of time. And compensation refers to how people actually adapt and modify activities in order to negotiate limitations that they experience. This theoretical framework was brought forth by Baltus and has been also used by several other folks, but it's really it was presented as a global orientation to self-regulation, and actual testing of this SOC framework within leisure has been relatively limited. So what we endeavored to do was to develop a more context-specific measurement of selective optimization with compensation, and look at that in terms of older adults with arthritis. Another aspect is that research also suggests that both leisure and SOC strategies are shaped by environmental resources of individuals. So in one of our studies, we looked at resource-rich and resource-poor settings with the people that we were working with. Early on, I came to become interested in leisure and arthritis because my brother was actually diagnosed with ankylosing spondylitis when he was 29 years old, and I saw how devastating that was to him, and how a guy who was really active in sports and physical activities, really began to struggle, and I was very interested in learning more about the relationship between leisure, arthritis, and health as a result of his experience. So one of the very first studies that I did, I really focused on leisure style and aspects of leisure style to better understand how leisure style relates to perceived health. So I was interested in how important is leisure repertoire and leisure style to the health of older adults with arthritis. And this was with a sample of 460 older adults with arthritis, and what I learned was that we asked people to write down up to 6 activities that they did regularly that they would consider to be a part of their everyday leisure style or leisure lifestyle. The mean number that was reported was 4, and what we found was that individuals who had larger leisure repertoires reported better physical health, significantly better physical health. And one of the things we speculated about that finding was that perhaps those who have a broader number of activities from which to choose are better able to adapt because they have a bigger toolbox as they evolve through their own experience with arthritis. The other thing that we looked at was the relationship between leisure style and health, kind of looking at severity of their arthritis using the RAND Medical Outcome Studies SF24-item health perception scale as one of our key indicators of health. And what we found was that leisure style moderates the relationship between arthritis severity and physical health. And as you can see from this table, this graph here, those who reported having a very mixed leisure style that included both a variety of sedentary, active, and cognitive activities were doing much better in their perceived physical health, regardless of their severity, than those who had very sedentary, overly active, and highly cognitive-based leisure styles. And we also controlled for age, gender, education, and social support in this, and we found that this model explained 22% of the variance in perceived health. So it was really quite a large effect and pretty interesting. From there, we wanted to really dig a little deeper and find out how and why these people were with different leisure styles were doing better or worse, and how exactly were they actually using selective optimization with compensation strategies. So in the next study that my colleagues and I did, we really examined how older adults develop and use these SOC strategies for self-management of their arthritis in the context of leisure. And we wanted to explore whether these leisure-based SOC strategies used by individuals varied by environmental resources. So we utilize the Champaign-Urbana area, and there's a large number of older adults who live in this area, and there's a lot of different retirement communities and a combination of subsidized and public senior housing in the Champaign-Urbana area. We had 178 older adults participate in our survey. Primarily they were female. The mean age was 74. We did on-site data collection. Again, more than half of our data collection took place in senior housing facilities, so they were all community dwelling older adults. And we developed this leisure-based SOC measure. We also used the Arthritis Impact Measurement Scale, or AIMS, and we were able to compare research-rich versus research-poor people living in those different situations, because we were able to collect data from those higher end, moderately expensive to very expensive retirement communities, but also these subsidized and public senior housing facilities in the Champaign-Urbana area. And we controlled for age, sex, and marital status. And what we found was a very high degree of use of SOC strategies. So out of 21 possible SOC strategies, the older adults in this sample were using over half of them. And when we looked a little deeper, we learned that elective-based selection and optimization strategies really varied based upon marital status. So people who were married use more elective-based selection strategies. Individuals who were classified as resource poor actually use more elective-based selection and optimization strategies. So even though they were resource poor, they were really quite resourceful and creative in adapting and substituting and compensating. And individuals who reported more elective-based selection and optimization strategies reported also far fewer difficulties with activities of daily living, which is a pretty significant finding. And then, so that involuntary or loss-based selection also predicted pain, anxiety, and total health as measured within the AIMS. So going to looking at SOC strategies more qualitatively, we also what people told us that they did was that they really focused on essential activities. So one of the activities that was highly valued by them was time with family and grandchildren. And they said that when they're with, for example, one person said, when many of them actually said this, when I'm with my family, you know, I'm busy and I actually don't think about my arthritis. And someone else said, I should be walking instead of doing handwork, but I actually have more fun doing the handwork. And a lot of people reported restructuring leisure and adapting, whether that was cutting back on playing an instrument, so cutting back on the amount of time they do it so it wouldn't cause their symptoms to flare up. Other people substituted one activity for another. One person said their favorite activity had been dancing for the longest time, but now her favorite activity was reading. They also were very proactive in seizing opportunities, and in that they planned their leisure engagement around their symptoms based on time of day. Many people said that, you know, mid to late morning was the best time, so they made sure that if they wanted to plan to do an outing or physical activity, that was where they would fit it in, and that many were very, very committed to the health-promoting aspects of leisure, in particular leisure time physical activity. One woman said that you know, she used to think walking was a big waste of time, but she discovered that walking was very therapeutic and helped her manage and minimize her pain. And others said that it was really hard to do these physical activities or these activities they wanted to do, but definitely worth the effort, and they saw the benefits. In addition to the survey, we did 6 focus groups, and 5 facilities were chosen, 2 of which were resource poor. They lasted about 60 minutes, and we conducted these focus groups until we met data saturation, and we used a moderator's guide and member checks for credibility and accuracy, and everyone received a little bit of a gift in order to participate. We also used kind of purposive sampling, and this was a subsample of the larger study, and we did have a predominantly white female sample in these focus groups with not very many people married, many widows in that group, and about a third of them were resource poor, and most reported a diagnosis of osteoarthritis, and they had been dealing with it, most of them had been dealing with it for quite a long time. We used a content analysis procedure and looked at these broad themes of SOC based on the Baltus et al. Framework with the code book, and identified used independent analysis for themes, focusing explicitly on leisure and arthritis, and then looking at the transcripts for similarities and differences by environmental resources, and using a inter-rater reliability or coder agreement for reproducibility. So overall, the findings from those focus groups led us to really pinpoint that leisure time physical activities are integral to maintaining function. That's something that most of us know who have been involved in the OAAA Action Alliance, regardless of people's environmental resources. There emerged an importance of perseverance and determination. Most of these people talked about being very committed and very determined, and were able to use SOC strategies to overcome limitations and negotiate constraints that they experienced. Only the resource-rich folks noted actively seeking out kind of resources and acquiring new skills in there, but they also had on-site programs and activities that they could take advantage of without ever leaving their facility. So they were really more involved in structured programs because they had them available. And engagement in leisure time physical activities, structured programs versus individual involvement. The resource poor folks were very personally resourceful in making sure that they were doing the things that they wanted to do and needed to do, but they did them more on an individual basis. A lot of them didn't have transportation to get to programs, so that was definitely an issue with this segment of the population, whereas I mentioned the resource-rich folks were, they had things right there on site, and so they had a lot more programming to choose from. Some examples of things that, of some of the themes, people talked about being very committed to Tai Chi and walking for years, and if they hadn't done this activity, they would have deteriorated very badly. And another person said, I just get out and go. It helps me. I don't have to be with someone. It just feels better mentally, and it makes me feel better physically. And, I try not to modify my activities because I try to push myself. And some folks said that, Tai Chi hurts every time when you do the exercises, but you I always have to do it. Otherwise, my arthritis will just get worse and your body won't want to do anything. So there's a real acknowledgement and commitment to doing these things because they know it makes them feel better. In terms of future directions, what we hope to do is look at SOC strategies for self-management, looking at the role of maybe gender and race. We know that there are some strengths and limitations to focus groups. Sometimes people, you don't get the full view of what's happening in the group because some people tend to talk more than others, and some can influence others' opinions in the group setting. But the dialogue that occurred between and among members in our focus groups really demonstrated the abilities of these interactions to encourage self-management behaviors, and in many cases, it helped people kind of reevaluate their lifestyle choices. So hopefully in the future, some of these implications can be worked into some programming, and so that we can encourage more people to use SOC strategies to continue participating in valued and enjoyable recreation and leisure activities. And there you go. Any questions?
Thank you, Laura. That was great. I just want to remind people quickly, if you do want to ask a question, you can either type it in or and I can read it, or you may press that raise hand icon and I will unmute your line so you can ask yourself. I did want to say quickly, I appreciate this perspective on leisure time activity or leisure-based activity, because in the OAAA Action Alliance, and I think kind of in general, we focus so much on physical activity in perhaps a more strictly defined way, and weight management and other medical-based strategies, for lack of a better way to describe it. But I think the idea of leisure being such a great way to maintain emotional well-being and quality of life, it's definitely something we don't want to overlook.
Thanks,
Yeah, and I had one question about, whether you've had an opportunity to follow up with any of the groups that you studied. People made comments in the examples you showed at the end about how important they know that it is to keep up with, but that's always our struggle, is to get people to stick with these activities. So, do you have a sense of long-term strategies?
Yeah, so we were able to go back and kind of follow up more informally with these folks about 6 months afterwards, and their participation in this study and we also gave them, we sort of summarized all of this in a brochure and gave them recommendations, because people hearing each other's strategies was very helpful, because they were like, oh, I never thought about that, I should try that. So we kind of tried to collect all those examples and then share them back, both in person and through a print publication. And quite a few people had started some new things and were motivated to continue doing what they were doing. And a few of the people who were in resource poor, or public subsidized senior housing, had actually they lamented over wanting to become involved in some of these studies that happen, on the campus, these physical activity and aging studies. We have a bunch of them going on, and I was able to get some of them connected so they could get some transportation to the university so that they could participate, because they were like, we want to do that stuff too, but we take the bus, or we don't have a way to get there, and we feel kind of disenfranchised. So that was really encouraging to help kind of create a path to get them included in some of that follow-up work.
Well, I definitely understand your question. It does, thank you, and I appreciate the comments from the resource core group about transportation. As you know, for the Osteoarthritis Action Alliance, we have the implementation guide that we're getting ready to launch, and we address transportation.
Right.
And it's something that we're mindful of, making sure that there is public transportation, not just access, but when people use it, are there hang on one second. I think my audio is funny. Do you hear me okay?
There's a little bit of, I don't know, there's a little bit of fuzz, but
Is that better?
Yeah.
Okay, so I apologize for that. I was just saying, about transportation and whether that's easily not just accessible to people, but are there benches at the bus stop? Are there sidewalks for people to get there easily? It's such a broader issue to be able to get people to some of the resources that might be available to them. So, it's such a huge issue. I appreciate the feedback that people have given you.
Definitely.
So I don't see any other questions. Do you have any final comments for us, Laura? Otherwise, I think we'll kind of wrap things up.
Yeah, let's go ahead and wrap things up. Thanks everyone for participating today and thinking about the implications of arthritis for valued recreation and leisure activities and how people can use different strategies to adapt and substitute so they can continue experiencing these benefits and continue to stay engaged to maintain and improve their health and wellness.
Great. Thank you very much for your presentation today. And also thanks everyone for your patience with our minor technical difficulties. Our next Lunch and Learn is on February 18th with Dr. Darren Padua from here at UNC Chapel Hill, presenting on evidence-based strategies for ACL injury prevention. You can check out our website for today's webinar, which will be posted on the website as well as on our YouTube channel, and hope that you can tune in to the next one. Thanks everyone and have a great day.
Have a great day.